We have started today a quarter of an hour later than we normally do because of the observance of a silence for the victims of the Manchester bombing. We will have a few more words to say about that in the course of the meeting and of the NHS response to it. But may I start, please, by formally opening the meeting. I have had apologies from only one director, and that is Joanne Shaw. I need to invite any members of the board to review, please, their declarations of interest, all of which are tabled in front of us, and to advise now if there are any specific interests which arise which may be relevant to any item on the agenda. No, we have none. Thank you very much. I should again observe that there is no formal expectation of a fire alarm test this morning, so that if the alarm should go off, please follow the advice and instructions of our staff, who will escort us safely from the premises. We have now the minutes of the last meeting of the board. Could I please ask colleagues to confirm whether they are a true and accurate record? They are. Thank you. I've had no indication of any other business. Is there any other business? No. Thank you very much. Sorry, I should have said any matters arising. Jumping ahead of myself. So let me turn then to the Chairman's report. I'd like to start off by observing that we're holding the board under conditions of PERDA, and that is a cross-governmental requirement which inevitably cuts in at the time that a general election is called. Had the election timing been somewhat different, I think we would have rescheduled the meeting of the board. But as it is, I think we have to do two things. One is to be respectful of PERDA. The other is to try to ensure that it doesn't conflict with our requirements of good governance as a board conducting serious public business and conducting it in public. The way in which we have dealt with that in assembling the agenda today requires us to make some amendments to how we would normally have proceeded. And I would suggest that probably those which are the most significant are that in relation to the items on the agenda under the heading Governance, we have 4 items on the complaints policy, on managing conflicts of interest, on standards of business, and on external whistleblowing, in which I would like to propose to the board that we should have a full and open discussion of these issues, but that the precise policies we have felt on advice that we should not put up onto the public web at the moment because of the potential of breaching the PERDA requirements. I think it behoves us to be very cautious about PERDA, given the high salience of the NHS in any general election. So I should apologise to members of the public that the policies will not themselves be available, but that will not, I hope, inhibit a full discussion around the board table. The other 2 or 3 items that I think one should record right at the beginning of our discussions this morning are, first of all, the publication of the next steps on the 5-year forward view. That was being finalised at the time of our last meeting, and it is now a substantive agenda item on today's agenda. Thirdly, the cybersecurity attack, which affected the NHS very seriously 10 days ago. I will invite Simon to say a little more about that in his Chief Executive's remarks. But to remark only at this stage that it, I think, demonstrated 2 clear things. 1, the resilience of the NHS to the attack, and 2, the vulnerability of the NHS to future potential attacks, and to assure the board that every possible step is being taken to strengthen that resilience, working not only through NHS England, but through the arm's length bodies and the Department of Health. And then fourthly, to again make mention of the tragic bombing in Manchester and the unfortunate and devastating loss of life and really devastating injuries for those in NHS care still. Again, Simon will comment further on that, but as an exhibition of the solidarity which the NHS represents in contemporary society, it's a very, I think, striking reminder of the ultimate function that we're all here to fulfill. Let me then turn briefly to update the board on some of the activities with which I, as chair, have been involved since the last meeting. A series of public speaking engagements, including work that I've been doing with the Academy of Social Sciences leading up to the publication of the report on health to the people, trying to understand better how the social sciences as well as the life sciences have a role to play in promoting public health and reduction of mortality and morbidity. A presentation to the Dementia Conference organised by the Alzheimer's Society last week, again emphasising the relationship of the work that NHS does in the much broader context of social care and other interventions that are critical to coping with a major episode of and growing episode of cognitive decline across society. Secondly, a number of visits, including to Moorfields, and also discussions with the Royal Free Hospital on their use of modern technologies to advance the interests of patients, and also a recent visit to the Altogether Better Vanguard Dudley, accompanied by Sir Bruce Keogh and Sam Jones, to try to understand where our best performing multi-specialty community practices providers were heading as we move towards an era in which STPs will absorb a number of those functions and those concepts and take them further. And then, thirdly, a number of cross-governmental meetings working on the Genomics England board and on the 100,000 Genomes programme, meetings with the Department of Health across government, with the new National Guardian on speaking up, with the Policy and Health Services Commissioner, and working also with the team on the Life Sciences Strategy. So that is intended simply to keep the board abreast with activity conducted as chair. I have no further matters to report. I would invite the board to express any views, comments or queries on that report. But in the absence of that, invite you please to note it and to turn now to the Chief Executive's report. Simon, over to you.
Thank you, Malcolm. So, in a similar vein, given PERDA, this will we'll confine ourselves to immediate operational matters. And as you say, I want to really focus on the work that's happened since our last board meeting in responding both to the cyber attack and the Manchester outrage. And as you cast your mind back, you'll remember that 8 weeks ago at our public board meeting, we actually reviewed the NHS emergency preparedness and response arrangements and the training and the drills that are regularly run to ensure that they operate smoothly. Unfortunately, since that meeting at the end of March, we've had these two major incidents. Firstly, the cyber attack, which we stood up a national response to beginning at 4 o'clock on Friday, the 12th of May, which lasted a week. And then, secondly, Manchester. In respect of cyber, I think the first thing to say is that this was probably the first national scale of threat that the NHS had received, and some very effective work took place in response to that. I think there are a number of lessons that NHS Digital, NHS England, NHS Improvement, the National Cyber Security Centre will be taking from that. Some of them we have discussed as a board in private for obvious reasons due to the security-related aspects of that. But there's work that, under the leadership of NHS Digital and colleagues, we will be needing to take as a system over the course of the next sort of several weeks and months. But I really just want to actually talk more about the Manchester response. And as everybody knows, the regional emergency coordination process immediately kicked in on Monday night, has worked practically flawlessly. There have been effective trial runs and processes put in place across the major trauma hospital and ambulance service networks that have been rehearsed very recently, in fact. As of 6 o'clock this morning, there are 116 people who've received inpatient care in relation to the incident, and 23 people are still in critical care. The NHS is also mobilising appropriate support for children and young people, families and staff in terms of the psychological consequences of this. And the board knows that JTAC raised the threat level from severe to critical earlier in the week, so NHS England has stood up the national EPRR requirement that every NHS organisation now takes action in the way that we have specified according to long-standing response protocols, ensuring that all their staff are aware of what the local incident response arrangements need to be, that they've reviewed in the case of acute hospitals their operating theatre, emergency car staffing levels, blood supplies, ambulance and transport arrangements, and also confirmed what's called the mutual aid arrangements between different NHS organisations in a geography. And I think, perhaps finally, Malcolm, all I would say is that I think that term mutual aid kind of captures the essence of what we've seen in Manchester, not just between different organisations coming together to respond, but mutual aid as really the embodiment of what the NHS has been doing for the people of this country. And I don't think it could be put better than the way in which a senior doctor at Manchester Royal Infirmary involved in treating patients put it when he has said, an atrocity has been carried out which has had unmeasurable impact on countless lives. Many casualties were brought to our department, and dozens upon dozens of my fellow staff arrived to help. The response represented everything great about this country: compassion, empathy, tireless self-sacrifice, and above all, profound unity. So I think we, as NHS England, should put on record our huge debt of gratitude once again for the frontline staff of the National Health Service who have responded so brilliantly under these terrible circumstances.
Indeed, thank you, Simon. We will certainly record that. May I invite any comments or questions to the Chief Executive? No, thank you. We'll note that report. May we move on, please, then, to the next item, which is a report on the next steps on the NHS 5-year forward view. Simon.
So for the reasons you said, Malcolm, this is really a sort of formal report in that at our March 30th meeting, we were one day before publication of this, and the content constitutes our business plan, our operating plan for 2017-18, in line with the mandate that we're operating under. I think there is now great clarity about the things that we can see need to get done on urgent emergency care, on primary care, cancer, mental health, the 10-point efficiency plan that the NHS has laid out, and without preempting whatever may happen on June 8th, I don't think there's anything in here which would not be important for the NHS to be responding to over the course of the coming 12 and 24 months. So, notwithstanding the election campaign going on, in practice, the whole of the NHS is mobilising around making sure we're as well placed as we can be to get this stuff done for the patients and communities of this country over the course of the next year.
Thank you. I'm looking around to see whether I should invite any comments, but I am conscious that every member of this board has played a major part in devising the next steps document, and the non-executives have been deeply involved in this throughout the process. So unless anybody has anything further to add at this stage, may I actually commend the executive on behalf of the board for the production of the report, to stress, secondly, its interdependence with other arm's length bodies and other players across the system for delivery. And thirdly, to note that we will be monitoring progress of its implementation and delivery across the country very closely. Are we content to note that report? Thank you.